my name is Christine. I'm a nursing student at the University of Pittsburgh. Right now I'm a junior in the BSN program, which is 4 years. And so I will get my bachelor's degree in nursing, and then I will take the national exam for nurses to get my RN license at the end of my senior year. And I hope to earn my degree and license in order to practice as a nurse for a few years before applying to nurse practitioner school. So that's my plan right now. But I just want to go over some of the different aspects of nursing and some of the different options and the different things it takes to become a nurse. So first question is, what is the training for my profession? Generally, one of the most common ways to become a nurse is to do a 4-year degree program. I'm in the traditional bachelor's program, so 4 years to earn a bachelor's degree and then take my exam to become licensed. But you don't need a bachelor's degree in order to become a nurse. You can become an LVN, which is a licensed vocational nurse. You can become an LPN, which is a licensed practical nurse, which involves about 12 to 18 months of schooling. You can become an RN, which is a registered nurse, which everyone will become, but you can do that by getting an associate's degree, which usually takes 2 years. You can get your bachelor's degree or your bachelor's degree, which is what I'm in, and that's 4 years. And also, if you graduate college with a degree in another field, you can also do accelerated programs, which are usually around 18 months or 2 years to get your bachelor's degree. No matter what school you go through, at the end of your education, all students are required to pass it's called the NCLEXRN exam, which stands for the National Council Licensure Exam for Registered Nurses. And this is an exam that all nurses have to take in order to become a nurse and become licensed to practice in a hospital or other healthcare setting. And all the schooling involves clinical experience, which is when you go into nursing homes, hospitals, clinics, and other settings, and you practice your skills in real time and on real patients, which is a hands-on experience. And I think that this is the best way to learn and practice the skills you learn throughout school. And all schools will require you to do this. It's a little bit intimidating at first, but it really helps you learn, and you're always being watched by an instructor. Another question is, why did I choose this profession? And I chose nursing because I felt that it most aligned with my personality traits and what I felt I most wanted in a career. And nursing involves the most direct care with your patients you can get. And I felt that I could become really good at this. And I felt purpose in what I could do each day. And I love helping and caring for others, and I felt nursing had the most purpose for myself. It's challenging, interesting, and makes a difference each day. And as I go through school, I think of my family constantly, and it gives me purpose to do my best in caring for others, as I would want them to receive the exact same care and the best care possible by each nurse and each different healthcare professional that they come across. One positive aspect of nursing and the profession is the difference you make each day. As I've said, you see multiple patients each day, and some during the worst days of their life. But if you could be that one person who has the ability to change their day or to bring in a smile, you're one of the first people that they see and one of the most often that they'll see. So you can really make a difference in their day. One negative aspect that I would say about nursing and the profession is probably the stress of it, especially throughout the pandemic. We hear about nurses who are overworked and super stressed, but as long as you learn, obviously I don't have personal experience yet as a nurse on a different, like on a hospital floor, but it can definitely become overwhelming. But I've been taught by my professors and different instructors that as you learn and develop your skills, you'll become more confident in the skills themselves, your time management, and different ways of communications to help ease your stress. Another topic is the job outlook and salary for the profession. And right now, the job outlook for nurses is really, really high. Hospitals everywhere, different doctors' offices everywhere are looking for nurses. And because of the pandemic, there's just a need for more and more nurses, and you can basically just get a job right away once you become licensed. Nurses are everywhere, anywhere. They're online, in person, in hospitals, in doctors' offices. The salary for the profession, it increases. It kind of depends, but some places you get a higher salary for the higher education or degree you have, and it depends on where you live. But in a 2020, the average pay was around $75,000 per year. So I think this is pretty average, but the more experience you become and the more education you have, the higher your salary becomes. And obviously you can specialize and get higher degrees that would pay more. Some advice that I wish I had or things that I would do different. One piece of advice that I wish I had before applying to nursing school would be to shadow a nurse before going, or shadow different kinds of nurses. Through school, you get a lot of exposure to nurses and hospitals and such, but there are often students who realize that nursing isn't for them once they hit the hospital. So I think that shadowing and getting a step into the different types of careers and the different kinds of nurses you can be can really help keep your passion and keep your inspiration for becoming the nurse that everyone needs. The exposure that I got from my clinical experience and through school really solidified my desire to be the nurse, but it's also not the same for everyone. So another way to get this exposure is shadowing a nurse. So you can contact hospitals and organizations who offer this just by, you can Google shadowing experience for high school students, or you can contact someone that you know, and it's really very common to shadow nurses. And they're usually pretty welcoming because they want as many nurses as they can get. Another piece of advice that I'd want to give is that nursing school is really intimidating and it is very hard. But from the start, you're learning things that are directly applicable to your job. So rather than taking just general science classes your entire career, nursing school has you starting right off the bat usually. So it really helps keep your drive to do better and to study harder. And right now, a lot of nurses are going through COVID, and it's hard to want to join something that has a negative look right now. And it's so easy to turn your head to a different career path, but nurses are never not going to be needed. They're the most important part of any hospital. And if you want to become a nurse or you're thinking about it, do it, because becoming a great nurse is something that is so achievable, and it's something that is so great if you have a passion for caring and helping people in such a direct and hands-on way.